Hello, thank you for watching this video on mole and cyst removals that we provide at Riverbanks Clinic. I'm going to share with you really some basic principles which are important for you to understand before you choose to go ahead with any procedure such as this. First of all, I'd like to explain that moles can be cancerous, i.e. malignant. And the first thing we need to do is to try and exclude any higher risk of your mole being malignant. And the really simple thing to look for is the ABCDE melanoma rule, which helps you identify any moles that are potentially should be removed surgically or through your GP via the NHS specialist services. So first of all, A stands for asymmetry. If your mole is uneven, half the mole is a different shape to the other side of the mole, this is a potential risk factor. If the color of your mole is changing throughout its life and there's lots of different colors in it, that's another risk factor. If the borders of the mole are irregular, uneven, and that's new, that's changed, that's a risk factor. If the diameter is more than 6 millimeters, so in other words, about the size of a pencil eraser, that increases risks. And also if there's been significant changes over the recent few weeks and months, then it should be checked. Now, not just one of these on their own could mean you've got a malignancy, but if there are several of these features, that's suggestive of a higher risk and it should be excised and analysed in the laboratory. There are other risk factors which we look for in your previous history. If there's a history of sunburn, particularly as a child, if you're a regular user of sunbeds, if there's a previous history of skin cancers in yourself or in a close family member, and also certain drugs such as those used to suppress the immune system, such as after a transplant. So we will be checking for these. The only way to be 100% certain of a mole of its diagnosis is really to take the sample and send it to the laboratory for analysis. This is called histology. This unfortunately comes at extra cost, but for some moles where we are suspicious, we would recommend this course of action. Thankfully, most moles are benign. They haven't changed. They've been the same as they were for years. You've had them since childbirth. And these can be safely removed without lab analysis. I would say that for most moles that are sit in the skin and sit in the dermis and have not had any recent changes, we could very safely laser those away. If they're a little bit more raised or sit on a pedicle like a skin tab, they could be removed with radiosurgery, which uses radio frequency energy. Or if there's any suspicion or they're a bit bigger or they have a lump, there's a cyst inside, then they'll need to be excised. And these are the results you can expect from a mole removal. Very commonly we see these on the lip, and here you can see about 4 weeks later a little bit of redness, but over the course of time that will fade to normal skin color. Lipomas and cysts. So lipomas are balls of fat. They're benign tumors of fatty tissue, and they are often found on the torso, the limbs as well. And cysts are often sebaceous cysts. If they are smaller than about 5 centimeters in diameter, we are allowed to treat them here at the clinic. And the aim is to remove these intact because that reduces the risk of recurrence. However, if there's a history of previous infections or previous attempts to remove them or ruptures, that will complicate the issue. There's a chance of recurrence. It might make the procedure a little bit more tricky because usually a little part of the cyst or the lipoma may be left behind. These will require excision. These will have a linear scar. Stitches, depending on the part of the body, will need to be removed at 5 to 10 days. And we like to do that for you. But usually this treatment is definitive. You won't need another treatment if all of the cyst or lipoma has been successfully removed. Now, viral warts, these are very common on the fingers and feet. Many people try freezing first or bazooka, verruca or verruca treatments, over-the-counter preparations. And by the time if those treatments haven't been successful, they usually come to me for treatments and solutions. We use the CO2 laser for that. These results have been very effective after 3 or 4 treatments with a CO2 laser. The aim is to vaporize the wart down to its root. We know we're at the root because you just start to feel a little tingle. New evidence has suggested that pulse dye lasers, which we also have at the clinic, are good at treating those as well. So, and the best thing about these is that you don't need an anesthetic injection. Here's another example on the thumb here. Age spots, also known as serebaric keratosis or liver spots or sunspots. These sit on top of the skin. They usually develop with age, and they usually get them on the face and on the torso commonly. They sit on top of the skin. They are usually benign. We give you a local anesthetic injection, and we use a laser to vaporize the top surface and then debride, so in other words, scrape away the remaining layer. They heal very quickly. This result here is just 2 weeks apart. Skin tags, very common, particularly around the neck, which get caught in necklaces, chains and tops and through shaving. So they are a nuisance. They become recurrently traumatized by shaving or getting caught in jewelry. So what I do, we give a local anesthetic injection. I use radiosurgery to remove those and leave a very pale circular scar under the at the base here, and heal within about a week to 2 weeks. Very simple. So CO2 lasers are the primary treatment I use for removal moles, mainly because they are ideal for flatter moles, and also they heal as a graze and heal virtually with an invisible scarring. Radiosurgery is used for skin tags, and as you can see, it's got a little loop here, and it allows me to get to the base of the skin tag and cause very little trauma. And again, these heal very invisibly. And finally, an excision. So maybe we will shave a mole and then laser it. But if we need to excise the moles or the cyst, this is the scar, and you'll be left. And eventually that will heal as a linear scar, paler to your skin. So when you come to the clinic, really what to expect is you'll be here for no more than 30 minutes typically. We'll take photos of the areas to be treated, we'll clean you, and then we'll also give you a local anesthetic injection. I'll then remove the mole or the area using one of the 3 methods I explained before, and then we'll give you some antibiotic dressings and plasters, and then I'll give you some instructions. You'll receive those later on in the day by email, and we would like to see you 5 to 7 days for a checkup and also to remove any stitches if necessary. It's important that you keep the areas protected with vaseline or the dressings we've given you for 48 hours to protect from any dust and any risk of infection. Wash with salted water or antiseptic solution until the wound is dry. That's usually about 3 or 4 days. And then we do recommend using SkinUVA growth factor, which combines jet silicone gel as well, to maximize the healing and minimize the risk of scarring. And this should be, if you have stitches, this should be used once the stitches have been removed. Please remember to always use SPF over any area that has been surgically treated whenever the area is unexposed. This will minimize the risk of hyperpigmentation, in other words, darkening of the scar later on in life. And if you're worried about anything, please do contact the clinic at any time. People often ask about scarring. Look, we have to expect there is going to be some mild form of scarring. You know, it's no difference if you cut yourself. There will always be a tiny scar, but usually it will heal relatively invisibly. Lasers heal the quickest, and excision scars, which linear, can take up to 2 years to fully mature. When I say fully mature, go from a healing phase of redness and thickening to pale white scar that doesn't feel like anything in them. So that's something to bear in mind. And in fact, plastic surgeons generally don't revise scars until the scar is minimum 2 years old, because it's done its thing at that point. Redness is not scarring. It's important. That is healing. If the redness is bothering you, we can reduce that redness with the VBEAM laser after surgery, after the stitches have come out. And in fact, there is some evidence to suggest that the VBEAM laser can improve overall appearance of the scar after a treatment. Again, to minimize the risk of scarring, I would recommend using the growth factor silicone gels such as the SkinUVA cream. So what are the complications following a minor operation at Riverbanks? Well, first of all, regrowth of moles is quite common. It's not unusual for a mole to want to grow back unless it's been fully excised. In other words, with a linear scar. So with lasers and radiosurgery, they can come back and they may require top-up treatments. I would say it's the minority of cases, that's for sure, but don't be surprised if in some cases the mole comes back at about 6 to 8 weeks post-treatment, in which case you just attend for a quick top-up treatment. Infection is incredibly rare if you follow the correct aftercare protocol. We operate under very strict hygiene conditions at the practice. But if you are worried, please let us know. Hyperpigmentation is also called darkening of the scar area. This can happen if there is slower healing than usual. It's more common in darker skins and in infected wounds. Again, let us know if there is slower healing or you're worried. We can use the VBEAM laser to accelerate that, or there are some skin creams which we can prescribe for you. Now, keloid scarring is a relatively rare condition, but it is much more common in darker skin types and when you have any operations near the midline. Also, if you've had keloid scarring before. So these are things to consider. And if you are at high risk of having keloid scars and the mole isn't affecting your health or significantly affecting your health, I would advise not to do this procedure. Should you get a keloid scarring, we have the facilities and the equipment and the technology to manage that for you. So how do you proceed from now? Well, first thing really, if you haven't already, please book a complimentary online consultation with myself and one of my colleague doctors. During that, we'll discuss suitability, whether it's worth you coming down, and give you an estimate of costs. Then if you do wish to proceed to a treatment day, what you do, you go via the app or the website and please book a minor operation. And you'll see the availability there and then. Latest costs will be given via email to you. And if you have any further questions, we're more than happy to address those for you. Thank you very much for your time. If you found this video informative, please click the like button. And also, please subscribe to our channel so you'll receive the latest notifications of when we produce new videos for you.